Hello, and welcome to another edition of Revive and Thrive. This is episode number 16. I'm your host, Joshua Blum, and today's episode is brought to you by the letter P. P stands for posture, and we're going to be talking about how that relates to physician burnout for fathers in just a second. But if you're new to us, what we've been doing for the past couple of months is we've been going through the alphabet one letter at a time, and for every particular letter, we've been talking about a little topic related to burnout, specifically for physicians and specifically for physician dads, because there's not a lot of stuff for dads out there in this particular realm, or at least not that I have found. So today we're actually going to be talking about posture, and you might be wondering, okay, so posture, like the sort of thing that parents might nag you about when you were a kid, stand up straight, sit up straight, that kind of stuff. Yes, we're actually going to be talking about that and how that actually relates to burnout. Burnout is not a medical term, as you probably know. It's a constellation of things. It's a descriptive, qualitative kind of term that goes along with an overall sense that what people do is not particularly meaningful. Now, it could apply to lots of different things, but we're using it in the context of work, in this case, a medical job. And so the idea that what you do is sort of meaningless or doesn't have a whole lot of impact, despite the fact that it may take a lot of work, despite the fact it may have taken a lot of time, is particularly significant because a lot of jobs in medicine, a lot of the work that we do as physicians is very time intensive. It just takes there's a lot of moving parts to it. And what ends up happening is that, of course, ends up being stressful in various ways. Now, it's fine if things go well, but as anybody will tell you who's been practicing for just a little while, things don't always go well. In fact, more often than not, there are problems. The way our whole system is structured in the West for medicine is it's not necessarily proactive. It is more reactive, meaning that patient comes in, they come in because of a particular problem. They come back because there are more problems. Sometimes intervention begets more intervention, and it kind of goes on and on and on and on. So how does this actually relate to how we stand, how we sit, how we carry ourselves? One of the things that actually happens is when we are in pain for lots of different reasons, a lot more things bother us. Now, if any of you have had chronic pain of any kind, you know how that can kind of nag at you. It may not necessarily be something that you experience all the time, but if it's chronic, it's pretty much more or less always there. And you may notice it more in times when you're stressed. You may notice when there's not a lot going on and there's less stimulation. Those of you who deal with folks who are diabetic and deal with neuropathy, often patients will report that pain is worse at nighttime, for example. Why is it nighttime? Because they don't have a lot else going on there. All they have to do is their thoughts and the process of falling asleep and whatever pain they have in their body, and they may notice that more at that time. There's less going on. If any of you have had pre-existing injuries in certain muscle groups, I would say back, shoulders, knees, those kind of issues like that, you may notice those areas hurt more. Now, we're going to be talking about this in more detail in a future episode, so I won't go into it a ton now. But if you think of your body as a series of like tension bridges, our musculature is designed not necessarily unilaterally, but in most cases to be opposing muscle groups, agonist, antagonist, right? And so things have to be in a certain kind of balance in order to be at rest. So think of your spine in terms of those ways. You have posterior muscles and you have anterior muscles. When people spend a lot of time hunched over, let's say they're sitting at a desk, sitting over a computer, which many of you may be doing as you're typing notes, often our posterior muscles have to engage in order to keep our head from falling down on the keyboard. When we are sitting, usually our legs are flexed at the knees, not necessarily always, but generally speaking, our body is, however, flexed at the hip, so we can actually sit in a chair. Now, this may be a little bit different if you're reclining in a beach chair or those kind of things. But generally speaking, if you're sitting at a chair working at a desk, your body's flexed at the hip. What does that mean? The hip flexors that pull your knees into your chest, they're contracted a little bit, not fully, but they're contracted. And that means the opposing muscle groups, in this case, the glutes, will have to relax a little bit in order for that to happen. If you're sitting with your knees and they're flexed, then the hamstrings are engaged a little bit. The opposing muscle groups, the quadriceps, they're disengaged. They're more relaxed. So you stand in those, you sit in those positions long enough, those muscles will continue to be tight. Now, if this goes on for a whole workday, you may notice that you feel a bit stiff at the end of the day. The same could be true of standing. Muscles will have to engage to keep you upright. So what happens when we have good posture is that we get a position where the ankles, the knees, hips, shoulders, and ears, in other words, our head, are all in alignment. It's the sort of alignment that you would have if you're lying on the floor and there's nothing under you. There's no pillow or anything, and everything is, you're completely supine. You're on your back, you're looking up at the ceiling. The same position could be if you were standing against a wall. No molding at your feet. Your heels are directly against the wall. It's the kind of position you would be if you're getting your height checked at a doctor's office or something like that. Your head, like the occiput, is directly against the wall. Everything is like your shoulders are, your butt is, and so forth. So everything is in a line. So that's the position that you're in if you are in correct alignment with all those different parts of your body. It's actually the sort of position you might be in if you're actually holding something over your head and putting it in a shelf, like above you. Generally, everything is going to be in a line or pretty close to it then. So why is that important? Why harp on that? Well, the reason is that at that particular point, muscles obviously have to be engaged, but minimally, right? So the agonist and antagonist muscles are engaged in such a way that it's enough to just keep you in that position. Remember, like without our muscles, we're falling over. Our bones, they don't have a whole lot to hold them in place. I mean, we have connective tissue and so forth, but the muscles are really what are tensing to keep us in those positions. At that particular point, that point of quote unquote good posture, we're actually in that position and muscles are engaged minimally. Now, if we get out of that position, we hunch over, like if we're sitting or we're standing with a slouch, that means those muscles actually have to work. Some muscles have to work a little bit harder. Like for example, if we're sitting and we're staring at a phone a lot, or we're sitting and are hunched over a desk doing notes or something like that, those posterior chain muscles have to actually fire to keep you in that position. And you may notice that your shoulders hurt, your neck hurts, because those muscles are sore. You may notice that if you spend a lot of time sitting, your lower back hurts. And there's a whole reason for why this is, and we'll go into this in a future episode. But if you look at go back to anatomy, pull out that netter, pull out the grants or whatever, and look at where the hip flexors engage. There's a couple different muscles in the hip flexor group. One of them, the biggest one, is the iliopsoas, and so it attaches to the lower spine. Our spine has these curvatures, right? The lumbar curvature and so forth. But if that muscle is tense, then it's going to be pulling on that lower spine, and it tends to pull down. Basically, it's going to be inferiorly and anteriorly, sort of like, because depending on the way your leg is, but it's going to pull that lower lumbar spine in that direction. Your lower back doesn't like that. Your body doesn't like that. Your body doesn't like those kind of tug of wars. So it's the lower back muscles, they're going to pull back on it to try to oppose that force. And so you end up with this tug of war. Anyway, those muscles in your lower back are going to end up being tight. Now, tight muscles get cranky. Tight muscles are ones that are more prone to injury. So you may notice that if you are, for example, in a cold environment, you're more likely to hurt yourself if you're doing something strenuous, if you haven't warmed up, because cold muscles don't get good blood flow. Cold muscles are more likely to be less resilient, and they're more prone to getting pulled. That sort of thing can occur and make it more likely for us to literally just bend down and touch to tie our shoes or sneeze or do something that seems very benign, but yet literally pull a muscle in our lower back or places like that you're like, what is going on? This is what it means to be an adult. I bend over and tie my shoes and I pull a muscle in my back. If those muscles are tight and they're not, by definition, they're not very flexible at that point, yes, you could. Unfortunately, I speak from experience here. Paying attention to your posture may seem like an external kind of thing, but sometimes we have to work from the outside in. Paying attention to how you sit, if you do spend a lot of time sitting, can be important, because anything that's going to add to the overall bandwidth shortening that you may experience when it comes to your work is probably worth doing if it's going to help you be in less discomfort. Now, there's a whole relationship between mental stress and physical pain. And part of it, of course, has to do with our perception of pain, which is, of course, mental and related to the way the nervous system works. But also, it has to do with muscles that tighten up to protect us. Again, we're going to be going over this in a future episode, but it has to do with our body's protective response and the action of one of the cranial nerves, the vagus. And so we'll talk about that in the future, but just you may already be aware of this. Those of you who do primary care, who do orthopedics, you see a lot of back pain. And so you're probably aware of this on many levels already. And so I don't need to tell you any of this, but you may be aware of that folks who are under more mental stress deal with more neck, shoulder, and lower back pain. Now, often patients, when they come in for those kind of interventions, and we have sort of limited things, we may refer them to physical therapy, prescribed medications like muscle relaxants or pain medications, or in some cases, things need to be surgically operated on. But this side of it, which is dealing with maybe the underlying cause, is certainly not something I ever received instruction in medical school. You may be different. You may have received that or have been working with people who kind of focused on more of that side of it. So again, how does this tie in with burnout? Well, if you think about burnout being a stressful state to the body, and we definitely know this from folks who are undergoing depression, like clinical depression, that's a stressful state. There's some theories that maybe that's an inflammatory state for your body, and it kind of fits with a lot of other inflammatory conditions. But either way, it is a difficult time for your body. Often, a lot of these muscles will be tense and guarded, to protect you, because your body really only knows a couple ways of like dealing with a chronic versus an acute stress. It doesn't really know the difference. That's the thing. It sees something that's stressful in the environment and it reacts, and a whole cascade of things happen. And a series of those involve tensing up muscles. And so if you counteract that in various ways, if you do things to make it so those muscles don't necessarily have to be that way, then you're kind of doing yourself a service. If you do notice that those muscles there are already tense and you do spend a lot of time sitting or stationary in one space or in one place, move around. If you have the chance to do that, move around. And you may notice that it is less bothersome. If you can get up and move around every 20 or 30 minutes or so, if you have the option to stand when you're working as opposed to sitting, particularly if the sitting surface that you're working on is not very supportive. If you have a tendency, instead of, I've noticed I have this tendency sometimes, if you're sitting in a chair and you tend to lean forward, the ergonomics of the workstation may in fact not be very good. Many places you can adjust them. But if you can sit with your back actually supported on the chair, and if you can raise the seating so it actually is level, your elbows should be at 90 degrees when you're typing. Your neck should not be craned upward or too far down. And so there's little adjustments that you can sometimes make. And sometimes you'll need someone else to help you with because you obviously can't see yourself. Someone can take a picture of you or can just look at it and see like, okay, you need to raise that chair, or you need to lower it, or the monitor needs to be at a different height. Or maybe forget all that and find a place where you can actually stand. But you want to make sure that it's at the right height for you. I notice, for example, I'm about 6'1", between 6'1" and 6'2". So certain things I have to hunch over to do because the tables and stuff like that they're not at a height where I can really do it. So if I have to do a lot of that, you feel it, right? Those of you who do surgery and spend a lot of time maybe hunched over, will feel this as well. And maybe getting something for you to stand on or adjusting the height of the patient on the surgical operating surface may be the way to go if you have that option. You don't always. So there's some things you can do, but paying attention to how you sit and how you stand may sound like, it may remind you of people harping on, those things when you were a kid, but it really actually can make a big difference, even though it sounds like a very little thing. And it's the sort of thing that you can actually practice any time of the day. And here's the dad part, because those of you who carry your children a lot or are carrying them in a forward-facing carrier, like a baby carrier, the weight of where the child is will disrupt the balance of those muscles, and certain muscles will have to work harder. And so, for example, if you're carrying the child in the front, now if they're pretty little, probably not a huge issue, but as they get a little bit older, those back muscles will have to work a lot harder to maintain equilibrium. And so you may notice that your back feels quite a bit tighter. So you have a chance to work on these things in those kind of environments too. And, you may notice that, if you spend a lot of time wearing your child, for example, then it's helpful to take breaks, a little bit more frequently. So those muscles don't hurt. So a couple things to play around with and think about. These are things that, like I said, you can practice really any time, and you're really working on aspects of both your physical and your mental health. So thank you for listening. Talk to you next time.